Microscopic world of sterile drug preparation. It's a place where life-saving medicines get made, but it's also a place fun. All right, today we're going deep inside the clean room. This is the high-stakes, microscopic world of sterile drug preparation. It's a place where life-saving medicines get made, but it's also a place where invisible dangers are lurking. And not just for the patients, but for the professionals making the drugs. And that sets up this hidden conflict, which really brings us to a fundamental question. How do you save a patient with a really powerful medicine without hurting the very person who's putting it together? Now, that is a huge question of safety, and it pits two absolutely critical goals directly against each other. To find the answer, we've got to understand both sides of this danger. So, to really get a handle on the solution, we first need to understand the problem. And it's really a tale of two very, very different kinds of danger. On one hand, you've got microbial contamination. We're talking invisible threats like bacteria and fungi. If those things get into a sterile drug, the result for the patient could be a life-threatening infection. But on the other hand, a lot of these powerful drugs, like chemotherapy agents, are hazardous by their very nature. So long-term exposure is a huge risk for the pharmacy staff who prepare them every day. So right there, you have two dangers and two totally different groups of people who need to be protected. Okay, so let's look at that first line of defense. This one is all about protecting the patient, and it's a standard known as USP 797. You know, at its heart, USP 797 has one simple mission: sterility. Its entire focus is making sure that the final medicine that reaches a patient is absolutely 100% pure. There is zero room for error. But how exactly does it do that? Well, it all comes down to a fundamental principle of physics. The main strategy of USP 797 is to create what's called positive pressure. I want you to think of it like an invisible shield. The cleanroom's ventilation system is always pushing super filtered, clean air outwards. This constant outward flow acts like a barrier, and it physically stops any contaminants from the outside world from getting in and messing with the medication. It's a really simple concept, but it requires a seriously complex and carefully engineered set of rooms to maintain that perfect protective bubble. Now, while USP 797 is building a shield to protect the medicine, a whole different standard is needed to create armor for the person handling it. And this is where USP 800 comes in. So, unlike 797, which is all about the product, USP 800 flips the script. Its entire purpose is containment, basically trapping any hazardous drug particles, dust, or vapors to make sure the pharmacists and technicians handling these powerful drugs are safe from exposure, day in and day out. And the need for this protection? It's massive. According to the CDC, a staggering 8 million healthcare workers in the US are potentially exposed to hazardous drugs every single year. So this is not some niche problem. It is a widespread risk for the very people we trust with our health. And the consequences of that long-term, little-by-little exposure can be incredibly severe. Studies have shown some really scary health effects, including higher rates of cancer, reproductive problems, and even damage to vital organs. It makes it crystal clear. The stakes for staff safety are just incredibly high. So how does USP 800 provide this protection? Well, in this fascinating twist of engineering, it uses the exact opposite strategy of USP 797. It relies on negative pressure. And this brings us right to the heart of the challenge, what you could call a true pressure paradox. This is the point where these two vital safety standards don't just differ, they are in direct conflict with each other. And listen, this isn't just some textbook theory. Out in the real world, getting these pressure relationships wrong is one of the most common reasons facilities fail their safety inspections. It's a ridiculously hard balancing act to get right. So here's the paradox in its simplest form. To protect the patient's medicine, USP 797 demands positive pressure. It wants to push air out to keep germs away from the drug. But to protect the worker, USP 800 demands negative pressure. It wants to pull air in to keep those hazardous drug particles contained. So you got this direct contradiction. It leads to the million-dollar question, right? How on earth can a single room push and pull air at the same time? I mean, it sounds like it's impossible. But it's not impossible. It just takes a really, really clever engineering solution that lets you satisfy both of these opposing needs at the very same time. The hero of this story, the key piece of technology that cracks this paradox, is the CPAC. That stands for Containment Primary Engineering Control. You can basically think of it as a high-tech, self-contained, ventilated box to work in. And here it is, the aha moment, the beautifully elegant solution to the whole paradox. You don't try to make one room do two opposite things. Instead, you create a room within a room. You put a negative pressure box, that CPEC, inside a larger positive pressure clean room. So let's just walk through how this layered solution works. First, the main buffer room, it's what's known as an ISO 7 clean room. Keeps that positive pressure going. It's constantly pushing clean air out, creating that sterile shield for the medicine. And that takes care of USP 797. But inside that clean bubble, the pharmacist works inside the negative pressure CPEC. This cabinet is always pulling air inward and then safely venting it right outside the building. And that containment box protects the worker from the dangerous drug particles. That satisfies USP 800. It's just a brilliant, layered approach that gets you both. Now, achieving this dual protection is, well, it's not simple. If you look at the official checklists, you can see the incredible complexity involved. They detail this long, meticulous list of engineering controls. Everything from how many times the air changes per hour to the exact placement of vents, all designed to make this layered system work perfectly and, most importantly, safely. So let's just recap it all. USP 797 protects the patient. Its method is sterility, and its tool is positive pressure, pushing contaminants out. USP 800 protects the worker. Its method is containment, and its tool is negative pressure, pulling hazardous drugs in. 2 standards, 2 goals, 1 very smart integrated system. And really, that's the big takeaway here. True safety in a modern pharmacy isn't about choosing to protect the patient or the staff. The real challenge, and the real mark of excellence, is mastering the complex engineering it takes to protect both of them at the same time. Which leaves us with a final, forward-looking question. As the medicines we rely on get even more potent and more specialized, how will our safety standards and our engineering have to evolve to keep up? How are we going to continue to protect the person getting the cure and the person who prepares it?